10,000 small businesses. We now see a face for one. So thank you very much for your testimony. Well, I just want you to know, Senator Ernst, I know, will agree with me. We hold many hearings during the course of a Congress. The four of you, very impressive testimony, very helpful to us. And each one of you stayed exactly within the 5 minutes. That's the type of, that's right, it is unheard of here. So thank you very much for the input that you've made to our committee. And I just really want to underscore a couple points. I'll start with Ms. Sweeney. We had a hearing that I chaired in the Senate Finance Committee last week on transplant needs, which basically we do a lot of kidney transplants because people are not taking care of their diabetes and hypertension. So what you're doing is critically important for the individual, but it's also important for our healthcare system because dialysis and transplants are extremely expensive, necessary, but expensive. But if you do the maintenance and prevention of diabetes or management of diabetes and dealing with hypertension, you reduce significantly the number of renal diseases, and particularly end-stage renal disease. So I just want to thank you for that. And you're focusing, which I thought was really extremely impressive, on underserved communities. So how did you get into that commitment, and does the system reward you for reaching out? Because as Mrs. Cook said, a lot of people don't know about the services. You have to do outreach. So how did the SBA tools help you in reaching this very vulnerable community?
With the WBC, we were able to focus on prevention right at the heart of the pandemic. That has always been our focus, but with the impact of COVID, that's where we narrowed in on prevention as the primary focus. 1 out of 3 adult Americans have prediabetes, which is the precursor. So what is the support that we have? Well, one, we are reimbursed through Medicaid and Medicare. Those are small numbers. Where the barrier comes is that there's a lot of administrative responsibility on our staff, and medical reimbursement does not cover it all. We're also a for-profit, so that limits our ability to get a lot of the funding that's in place. Maryland alone has received millions just these past few years related specifically to diabetes prevention and management, but we're rarely ever in those conversations. So that's one of our goals. But we do a lot of outreach in the community, and a lot of that is done with our outreach team, and that is primarily because that is the only way we're going to keep the conversation going about these preventable illnesses.
Thank you. The report that I referenced in my opening statement points out the disparities with women-owned small businesses. The number of loan rejections are higher than the male businesses. The number of women-owned businesses that have to use their own savings and resources and family resources versus their male counterparts is much, much higher. And the list goes on. The number of 7A loans, the number of 504 loans are much lower than the demographics would have you think would be right. And then you go to venture capital, which is almost non-existent in women-owned small businesses. And then on the contracting side, and you mentioned this, Mrs. Cook, the SBA, the government has reached all of its goals on small business set-asides except for women. We have not reached the 5%, which is not acceptable. So, Mrs. Somerville, you mentioned the use of the Women's Business Centers, the SCORE program for mentoring, and we talked about the need for mentoring. And it seems to be working well for you. Mrs. Cook, you had some concerns as to whether we have women mentors available, which I think is a really strong point in the SBDCs. How do you put together the tools that are there today, and how can we make them more effective?
I had a really good experience in terms of outreach and exposure to the different tools that are available at each of the SBA resources. And one of the greatest takeaway was the building of the networks that are offered that allowed me to have access to other ways to generate revenue. For example, with the Women Business Center, I was introduced to philanthropic opportunities in which I was able to compete in a pitch competition if you will, to gain additional resources. I was able to win about $14,000, and it enabled me to buy the IT tools I needed, my computers, licenses to build my company. And so I think it's the outreach and it's the resources that they exposed me to that were also in the community available. I simply would never have been aware had they not granted me the opportunity, access, and exposure.
Senator Ernst.
Thank you, Mr. Chair.